Hi everyone, my name is Auralia, and today I'm going to be presenting on the project that I did that was titled Collective Impact in Cochise County, Developing a Shared Measurement System to Understand the Impact of a County-Wide Health Initiative on Diabetes and Obesity. So the goal for this project was to research and develop a set of recommendations for implementing a shared measurement system in Cochise County in order to collect more local and up-to-date diabetes and obesity data. So to start, Cochise Building Healthy Communities is a collective impact initiative that has a goal of empowering their community to take the lead on identifying and solving their own health problems. In this context, shared measurement is a way to commonly measure goals and progress in order to figure out what's working and what's not working within the collective impact initiative. And collective impact is the dedication of a group or an organization to a common agenda to work towards fixing a complex social issue. So for this project, I conducted a few different activities throughout my time. The first started with reviewing the literature on shared measurement and collective impact initiatives to kind of get a better understanding of what those two topics meant and what they entailed. The next thing that I did was develop a list of key Cochise partners related to diabetes, obesity, healthy eating, and active living. And I did this with my site supervisor, who was really well connected in Cochise County, and together we came up with a starting list of people to reach out to and contact. I then had to create an interview guide for the interviews that I would be conducting with these key partners, and I came up with a set of 4 questions with some follow-up questions in addition to ask these partners. Then I conducted the interviews and facilitated them. And lastly, I took all of that information from the literature review and the partner interviews in order to create a set of recommendations for implementing a shared measurement system within Cochise County. From my literature review, I found that funding, infrastructure, and learning and improving were the 3 most common topics for why collective impact initiatives struggle initially with creating a shared measurement system. These shared measurement systems can be really expensive to create and maintain over time. There also has to be an adequate amount of staff to make sure that they're checking the validity of the data and that other staff members are getting the correct training on how to use the data. And then lastly, these collective impact initiatives should be making sure that they are learning and improving from the data, meaning they're using the data to guide future activities and goals, and they're using the data to figure out what works and what doesn't work in order to move forward in a successful way. From my partner interviews, these were the 4 main themes or key takeaways that I found. So it was found that electronic health records are utilized in Cochise County and they're up to date, which could be great for a shared data system. Although there is one downside, which is that the data has to be anonymized and processed on the back end, which requires infrastructure and money to be able to do that. The next key theme that I found was the Community Health Worker Program, which is being implemented by the Chiricahua Community Health Center. It's a really amazing program that could provide really great data, really up-to-date and local data as well. The template that is being used is called Prepare, and it's being integrated within electronic health records, which means that collecting this type of data will be more systematized and local and up-to-date, which is exactly what we're looking for. The next is painting the right picture. I learned through my experience with this project that Cochise County is filled with many diverse and unique cities that like to be recognized as such, and so making sure that the data represents that and paints the correct picture is really important. And then lastly, other relevant data that I found that should be getting collected or included in a shared data system for Cochise County was data like social determinants of health data. So collecting things like food access to sidewalks, or workplace stress would all be really great indicators to track progress on that would really help paint that picture for Cochise County. In conclusion, these were the 3 sets of recommendations that I came up with by the end of the project. The first was to apply to the Robert Wood Johnson Foundation grant. This grant is a grant for the Systems for Action, Systems and Services Research to Build a Culture of Health. This grant really aligns with the goals and initiative of the Building Healthy Cochise and would be worth looking into in order to fund a shared data system. Second, when creating the shared data system, it's important to include social determinants of health data, so making sure that that full picture is being painted. Otherwise, it could leave a lot of pieces of the puzzle out and not fully explain what's happening or what the cause is for certain health issues within Cochise County. Lastly, there were two partners in Cochise that I really wanted the chance to talk to, but because of time constraints and schedule conflicts, I wasn't able to. Those two people were Sally Holcomb and Andy Shanks, and I'm recommending to Cochise that they still reach out to those two partners because they have a lot of really great information on data that exists in Cochise County, and they could really help further the movement to create the shared data system. And I just really want to thank Joseph Sprietsma, my site preceptor, Rachel Lay, Michelle Walsh, the Cochise Building Healthy Communities organization, the Western Region Public Health Training Center, and the entire CRED team for supporting me through this whole project. I had such an amazing experience. Thank you so much.